Quick note: this is an automated educational summary of public medical sources, Mayo Clinic, the NIH, and Medline Plus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. You eat something. Within minutes or hours, bloating, cramping, or brain fog kicks in. You think, allergy or something else? Mayo Clinic and the NIH both note these are completely different conditions. Allergies trigger your immune system. Intolerances don't, and they test differently. Today, we're walking through the actual science behind food reactions, the tests that clinicians use to detect them, and what research says about the real triggers behind gastrointestinal symptoms. You're not diagnosing at home. You're learning what questions to bring to your doctor. According to Mayo Clinic, a food allergy is an immune response. Your body sees a protein in food, peanut, shellfish, milk, as a threat and launches an immune attack. That triggers histamine release, which causes itching, swelling, hives, or anaphylaxis in severe cases. The NIH notes that true food allergies affect about 4% of adults in the US. The key? The immune system recognizes the allergen every time. Even tiny amounts can trigger a reaction. It's reproducible and potentially serious. Intolerance is different. Medline Plus defines it as a digestive system problem, not an immune one. You lack an enzyme to break down a food, like lactase for milk sugar, or you're sensitive to additives. The reaction is dose-dependent. Small amounts might be fine. Larger amounts trigger bloating, cramps, or diarrhea. Intolerances are more common than allergies. They're rarely life-threatening, but they're genuinely uncomfortable. And here's the critical part: they don't trigger the same immune response. The Cleveland Clinic outlines two main approaches. Skin prick testing introduces a tiny amount of allergen under the skin. If you're allergic, a raised bump appears within 15 minutes. That's histamine reacting. Blood tests, IgE testing, measure specific antibodies your immune system produces to that allergen. Both are reliable for true allergies because they're looking for a real immune marker. The test is binary. Either your immune system recognizes the allergen or it doesn't. Results tell you whether your immune system is involved. This is where testing gets complicated. There's no single intolerance test. The CDC and NIH note that elimination diets, removing a suspected trigger for 2 to 4 weeks, then reintroducing it, remain the gold standard for identifying intolerances. Hydrogen breath tests measure undigested sugars in your breath, lactose, fructose. Stool tests look for digestive enzymes. IgG blood tests exist, but are controversial. Mainstream medicine views them as less reliable than elimination diets. The honest truth: intolerance testing often requires observation and a food diary, not just a lab result. According to Mayo Clinic, the most common food intolerances are lactose, undigested milk sugar, fructose, and certain additives like sulfites. Histamine in aged foods, fermented pickles, cured meats, aged cheese, triggers sensitivities in some people. FODMAPs, a class of poorly absorbed carbs, cause symptoms in IBS. Gluten intolerance differs from celiac disease. Celiac is autoimmune and damages the gut. Non-celiac gluten sensitivity doesn't damage tissue, but causes digestive distress. The NIH emphasizes that diagnosis matters because treatment differs. An allergy might require an EpiPen. An intolerance might just mean reducing that food. If you suspect a food reaction, here's what research supports. First, note your symptoms in a food diary: timing, severity, pattern. That's free and powerful. If you suspect an allergy, swelling, hives, difficulty breathing, ask your clinician for skin prick or IgE testing. If you suspect an intolerance, bloating, cramping hours after eating. Discuss an elimination diet. Removing the suspected trigger under medical guidance is safer and more informative than guessing. Cleveland Clinic notes that a registered dietitian can help you identify patterns without unnecessary elimination. You're not self-diagnosing with a test. You're gathering data to present to someone who can interpret it. Here's what matters most. Testing is a tool, not a verdict. Mayo Clinic, the NIH, and the CDC all agree that your clinician's interpretation of your symptoms, history, and test results is what actually guides safe next steps. An abnormal test doesn't always mean you need to avoid a food. A negative test doesn't mean you don't react. And symptoms alone don't tell you whether it's immune or digestive. The goal isn't a label, it's reducing discomfort while maintaining nutrition. That conversation happens with someone who knows you and your full health context.